welcome. You're watching the Health Site and I am SAKSHI. Case of mass hysteria has been reported in Uttarakhand where girls are seen banging their heads, crying, howling in school. So to talk about hysteria and the symptoms and the causes and what are the treatments of hysteria, in today's video we have an expert with us who is sharing her knowledge on hysteria.
I would love to talk about this in a very simple language. When you find hysteric symptoms, what are the hysteric symptoms? Somebody who is emotionally charged, and the behavior is out of control after that, is simply about hysteric behavior. Somebody who is not behaving normally, and emotional outbursts are happening. So the few symptoms that we see is some people feel blindness, they suddenly say, I can't see anything, they close the eyes, this is a very abnormal behavior. Some people have hallucinations. They start telling you that they see something, they're talking to somebody's calling them, like that. And most commonly, we see that, emotional outbursts in a very abnormal way. Shouting, screaming, beating their own body, their body parts, and falling down on the floor. Very abnormal behavior than when compared to a normal person.
Ma'am, as we were talking about abnormal behavior and that they harm themselves, right? The person who is suffering from hysteria. So, ma'am, why it happens, and do we have any instant treatment for it?
Yeah, so in my experience, because I've dealt with such cases in my work experience, most of the times I found that there is a suppressed subpersonality in a person that comes out in a very emotionally charged way. Meaning, I'll simplify it for you. We all have different subpersonalities. Each person, take a therapist, take a person, take you, take anybody. We all have different subpersonalities inside our own one mind. We use one personality when it is needed. When I'm dealing with you today, I'm using the subpersonality of a therapist when I'm talking to you. When I'm dealing with my clients, my patients, I use that subpersonality. The same way in normal life, if I'm back home from my clinic, I don't use that subpersonality with my family members. I take out another personality and I start behaving with the help of that personality. My behavior is totally around that. And these people, when the hysteria hits a person, it's nothing but, in a layman language again, they are using one of their suppressed subpersonality. That personality which is suppressed. I'll give you an example to simplify that further. You might have seen in villages and where there are like local gods and goddesses festivals that happen. One lady comes out and predicts the future for us. Like in my area in Telangana, we have Bonalu, that's a festival offered to, the prayers are offered to the village gods and goddesses. There you find a lady full of this turmeric applied on the face and big bindi, and suddenly they start behaving very different. This is one form of hysteria according to what the work that we do. What happens to these people normally is that suppressed subpersonality which was not allowed to express their emotions. Imagine a lady is in an abusive relationship with her husband, like physical abuse and emotional abuse. She undergoes that abuse for a very long time, and suddenly she takes use of one subpersonality that helps her in coping with this husband, this situation. So this is nothing but in order to avoid something, they take help of this particular subpersonality, which behaves in a way that might terrify the other people, so that it stops the other people to come close to them. And if you ask me it in a scientific language, like our language, we call it defense mechanism. due to the trauma, unresolved trauma, the unresolved blocks in the subconscious mind. What we do is, even us, even the people who study this also have these, is that we create a defense mechanism around us, like a layer, like a shield, in order to protect ourselves from certain conditions, certain situations. So this is nothing but a very strong subpersonality that has come out, is hysteria.
Okay, doctor, thank you so much for simplifying it for us. Doctor, moving on further, what are the long-term treatments for hysteria?
Do not try to pacify them. Do not try to stop them. When they are in that bubble called their reality, do not try to pacify or say no, don't behave such a way, or what you're doing is wrong. Don't burst the bubble. That's the whole point. Witness them with all the compassion. That's what we do. There is no big magical wand or a difference between a normal person, a friend, or a therapist. A therapist is just witnessing the whole process. So the family members, teachers, everywhere, every person around them should witness with all the compassion, non-judgmental compassion. So just let them process it. Let them process the feelings, the emotions, until they stop by themselves, is what I suggest in such conditions.
Okay. And ma'am, how can we make out that it is a hysterial attack?
Very simple. They are not normal. We all know when people are not normal, they shout, they scream. Even in a domestic scenario, even in family system and, in friends, among friends, in a party or in a gathering, sometimes we witness that people are behaving abnormal. The degree varies. And the case study that we are talking right now is a very extreme degree in the hysteria or an abnormal behavior, but in a very small degrees as well. We also sometimes are, we are venting out the emotions. We're angry sometimes. Yeah, every abnormal reaction, non-normal reaction, can tell us, the person is not normal. That's it. Very simple.
And ma'am, is hysteria a mental illness?
Yes, it is. It is.
Okay.
What happens normally in my practice, I observed with mainly female clients most of the times. We were told to suppress our emotions many times. Adjust kar liyo aap, you just get adjusted. Don't show this. Even to men, they say don't cry.
Right.
We on a daily basis. Yeah, meant to cry, but that lump of that emotion, that ball of that emotion, in a very simple way, again I want to tell, that unhealed trauma from childhood, imagine it to be a small block, is located in the subconscious mind.
And that is because of the suppression, because the thoughts and the emotions have been suppressed from a long time.
Mainly in my practice, I found it is mostly 80% is from childhood.
Okay.
The unhealed traumas take a shape and form of a block in the subconscious mind, and that block again and again it comes out, it tries to come out in any given situation. For example, because of any abandonment issues in my childhood, if I had developed a defense mechanism called anger, I use that anger in every given situation. I'm angry with the maid, I'm angry with the friend, I'm angry with my husband, I'm angry with my kids. So anger becomes my defense system to control the situations and people in my life. So for these girls that we were talking about, I suspect that there are definitely some undealt, suppressed emotions. And I found that these girls are around puberty age, 8th standard girls almost. So might be, hormonal kicking and physical, psychosomatic as well. And in villages, we find that their parents, their mother especially, in order to handle certain situations again, they behave the same way, like what the girls are doing now in that video. They might be copying their elders now in this situation in order to avoid certain conditions, certain situations.
All right, ma'am, as we were talking about females, so what causes hysteria in females more? As you were also telling us that more often have female crimes if we talk about hysteria.
Yeah.
So the ratio is more towards the female.
Yeah. So abuses, domestic abuse, even if a girl of that age in that video, if any of these girls are watching their mothers undergoing some abuse, some form of emotional, mental and domestic abuse, they also take that fear. Fear is the main factor in all these cases, hysteria, phobias even. You might have heard many stories about people washing their hands continuously,
right?
Washing the clothes continuously. And if you see, these things are very prominent in villages. There is no proper help. There is no proper education about this. Parents don't sit and talk about it. These girls observe their mothers undergoing domestic abuse or emotional, mental abuse by in-laws, by fathers, so they pick up these tendencies, the defense mechanism they develop. It's very simple. When I behave in a certain way, I can stop this person from abusing me, is the logic.
Okay.
He will go, he'll leave me.
If you have found this video knowledgeable for you, then do share this video with your friends and family, and don't forget to log into our website, which is known as The Health Site.